Aging or living with a serious illness can be very challenging. For example, patients often report that new physical limitations are affecting their ability to enjoy normal activities with family and friends, and they are struggling to understand increasingly complex medical information. For help, more and more people are turning to Rainbow Palliative Care, an important program designed to help people live well as their chronic disease advances.
The mission of Rainbow Community Care is enriching lives throughout aging, illness, and loss, and an important part of that is palliative care. Palliative care is a specialty in medicine that focuses on improving the patient's quality of life. The model of care is delivered through an interdisciplinary team with a goal to improve the patient's symptoms, reduce burdens associated with illness and aging, and help them plan for what may lie ahead. Rainbow Palliative Care works in collaboration with patients' primary care providers and specialists. Rainbow Palliative Care does not replace a patient's primary care provider, rather adds an extra layer of support. A primary care provider or a specialist typically focuses on either preventing disease or treating disease, where palliative care focuses on improving the symptoms associated with either the disease or the treatment of the disease.
Sometimes patients and families, and even providers, get confused and think that palliative care is the same thing as hospice care. It is important to understand there is a difference between these two services.
There's often a lot of confusion regarding the difference between hospice and palliative care. Though they both have a goal to improve a patient's quality of life and reduce symptom burden, palliative care can be provided along with life-prolonging and curative treatments, where hospice care is a type of care that's provided to patients who have a prognosis that's measured in months with a goal of comfort-directed care only. A patient can be terminally ill and still receive palliative care. Palliative care can be provided to patients all along a spectrum of disease progression as well as goals of care. We have some patients on palliative care who would want everything and anything done to live as long as potentially possible despite quality of life, all the way along a spectrum to patients who prefer comfort-directed care only and prefer quality of life over quantity of life.
The Rainbow Palliative Care team is comprised of several different healthcare professionals who provide specialized care to patients in the place they call home.
The Rainbow Palliative Care team consists of a nurse practitioner, a nurse navigator, a social worker, and if needed, a chaplain, a bereavement counselor, and a registered dietitian. Community-based palliative care means that the care is provided to the patient in the community. We've served patients in their home, wherever that may be, in a patient's house, apartment complex, assisted living, or skilled nursing facility. The frequency of visits from the palliative care team is determined based off of the patient's needs.
The Rainbow Palliative Care team works hard to help patients manage the needs of their bodies, minds, spirits, souls, and relationships. Better understand their condition, its possible progression and treatments, as well as express goals of care.
Rainbow Palliative Care manages the patient's physical, emotional, and spiritual needs utilizing an interdisciplinary team approach with a nurse practitioner, a nurse, and a social worker to not only assess but manage the patient holistically. We help patients understand their current disease status and likelihood of disease progression by first assessing what they understand and providing them with education not only about their current disease status but their disease trajectory, meaning what we typically expect to see over time in a patient with this condition, as well as their anticipatory needs, meaning what we anticipate the patient will need as their disease progresses. One of the most important things that palliative care does is help patients explore the things that are most important to them. One of the questions we often ask is, when you think about how you want to spend the rest of your life, what things are most important to you? And through these discussions, patients are often able to identify not only where they want to spend their time, but also how and with whom they want to spend their time. Our role in palliative care is then to communicate these to the patient's primary care providers, to their specialists, to the emergency room providers, to the hospitalist, and to their loved ones as well.
The Rainbow Palliative Care team also helps patients complete an advanced care plan, find resources that can support their goals, and gain access to phone support from nurses for symptom management and guidance.
An advance directive is a legal document that a patient completes to assign an agent to make healthcare decisions for them in the event they're unable to make them for themselves. It's important to not only complete the document, but also to have conversations with the patient and the healthcare agents regarding the type of care that the patient would want in the event they're unable to make decisions for themselves. Palliative care has connections with providers in the community along the continuum of care. And part of our role in palliative care is to connect our patients with resources to help them achieve their goals. If a palliative care patient has a sudden change in condition or a pressing question, Rainbow has a triage nurse available 24/7, 365 days a year for telephonic support and guidance.
Patients and families are often surprised to learn that palliative care actually helps them reduce their overall healthcare costs. This is achieved by focusing on the patient's personalized goals and avoiding unwanted emergency room visits and hospital stays.
Palliative care is covered by Medicare, Medicaid, and many private insurances.
Navigating the complex world of advancing chronic disease can be challenging, but support from Rainbow Palliative Care can help you learn how to make this part of life's journey easier and more meaningful. Whenever you're in need, please do not hesitate to call us at 920-674-6255 or visit rainbowcommunitycare.org.